This video will describe the integrated competencies for dietetic education and practice, or ICDEP, in the practicum setting. The integrated competencies provide an outcome-based standard for dietetics at entry to practice. ICDEP version 2 was finalized in 2013 after completing a 2-year stakeholder consultation process that involved input from practicing dietitians, dietetic educators, and the academic institutions across the country. Competency-based training ensures that learning outcomes and dietitian practice abilities are clearly communicated across students, teachers, and preceptors, as well as employers, government, and the public. It ensures consistent education and training across the country. This enables dietitians the ability to work across any province and enables international recognition of our credential. Finally, competency-based training ensures that education and training is aligned with current practice. This maintains our standing with our fellow health professionals, maintains our standing international, and maintains our standing with our clients, patients, and families, and the communities we serve in our practice. ICDEP identifies 5 domains of practice: professional practice, dietitians demonstrate professionalism; communication and collaboration, dietitians communicate effectively and practice collaboratively; nutrition care, dietitians provide services to meet the nutrition care needs of individuals; population and public health, dietitians promote nutrition health of groups, communities, and populations; and management, dietitians manage programs, projects, and services related to dietetics. Professional practice and communication and collaboration are foundational and underpin dietetics practice across all practice areas. Each domain is divided into practice competencies. There are 31 practice competencies, and each is further described with their individual performance indicators. Practice competencies describe the minimum set of practice abilities that dietitians are expected to possess at the point of initial registration. They are demonstrated by dietitians in their everyday work. While each practice competency is written as a distinct statement of ability, in practice situations, competencies are not applied independently. In reality, each competency informs and qualifies the others, and the dietitian applies them in combination according to the situation at hand and using their professional judgment. For example, conducting a counseling session involves the application of several nutrition care competencies, as well as competencies in professional practice, such as maintaining a client-centered focus, among other competencies, and competencies in the communication and collaboration domain, such as use effective interpersonal skills, use effective oral communication skills, and contribute to the learning of others. Performance indicators are the competencies or learning outcome expectations to be demonstrated when you are training to become a dietitian. They are assessed in your undergraduate program, during the practicum, and on the CDRE or the registration exam, and are applicable to the students in the BRESHA, MSCFN, and DDEP programs. They are an outcome-based ability that is observable to others. To think about this, consider practice competency 2.03, use effective oral communication skills. This is broken down into several performance indicators, including speak clearly and concisely in a manner responsive to the needs of the listener, use appropriate tone of voice and body language, recognize and respond appropriately to nonverbal communication. These performance indicators are what we are assessing in the student's performance in the evaluation process. Through demonstration of these performance indicators in training, it is assumed that the student has learned the skills to perform the related practice competency as they begin their work. Provincial dietetic colleges across Canada have stipulated that to be eligible for registration, all candidates must provide evidence that they have met the integrated competencies for dietetic education and practice, that they have a minimum of 1,250 hours of training in dietetic practice, and they've met the program requirements of a Partnership for Dietetic Education and Practice accredited dietetic program like Brush's practical training programs. They must also successfully complete the Canadian Dietetic Registration Examination, or the CDRE. In order to meet the program and registration requirements, students need to demonstrate competence across all performance indicators. That is to say, they need a competent rating on every item. Each placement context is different, so having a competent rating across multiple placements is important to demonstrate your overall readiness for dietetics practice.